Good morning to all. I am Dr.J.BHUVANA, Assistant Professor of Chemistry, A.D.M. College for Women, Autonomous, Nagapattinam. Today, we are going to discuss about chemotherapy. This chapter belongs to 2nd BSc Zoology, Allied Chemistry. What is meant by chemotherapy? Chemotherapy is a method of treating diseases caused by bacteria and other microorganisms is called chemotherapy, and the curative agent chemical compounds is called drugs. So chemotherapy is nothing but the disease that is cured by a drug is called chemotherapy. Next, what is meant by drug? A drug is an organic compound, may be natural or synthetic. It creates physiological effect on body functions. It selectively destroys the microorganism without affecting the normal functioning in the body of the person or animal taking it. There are several criteria by which the drug can be classified. The drugs can be classified by different types of criteria. There are approximately 5,500 chemical entities which can be used to treat diseases in human in suitable formulations. Hence, these have to be classified into groups to facilitate comprehension and assimilation. Drugs are regarded as biologically active chemical compound, mostly with a therapeutic purpose. So, drug is a biologically active chemical compound which is used for therapeutic purpose only. The drugs may be broadly classified into 4 types. So, what are they? They are biological classification, chemical classification, classification of drugs according to commercial consideration, and classification by the lay public. So, the drugs can be classified based on the above 4 categories. So, we have to discuss one by one. First one is biological classification. Biological classification is based on pharmacotherapeutic and chemotherapeutic agent. This is a disease-oriented classification of medical agents used in various diseases, and hence the classification is based on medicinal agents which are overall descriptive but not very accurate on scientific ground. So, this is not accurate on the scientific ground, but it is a overall descriptive. For example, the term painkiller, hard drug medicine, diuretic medicine, local anesthetic, etc. In each of these categories, sometimes compounds with entirely different chemical structures and different biochemical modes of actions are grouped together. The broad classification of drugs based on the biological effects is as follows. Based on the biological classification, the drug is classified into 4 types. First one is drugs acting on central nervous system and peripheral nervous system. These drugs act on central nervous system of the human body, which consists of brain and spinal cord. It controls and regularizes the special functions like circulation, digestion, respiration, etc. It also modifies the physical reaction such as feeling, attitude, thoughts and memory. The ability to think logically, to remember the past experience, communication are unique qualities of man, which can be attributed to the development of highly specialized central nervous system. These drugs, which affect the central nervous system, can either stimulate or depress the central nervous system. Second one, on biological classification, chemotherapeutic drugs. Various drugs used in chemotherapy are known as chemotherapeutic drugs, which have important therapeutic use in the treatment of parasitic infections due to insects, worm, protozoa, viruses, bacteria, etc. These drugs destroy, offending the parasites or organism without damaging the host tissues. Paul Ehrlich, an organic chemist, is called the father of modern chemotherapy, who was awarded Nobel Prize in 1909. He awarded the Nobel Prize in 1909 itself. He successfully used for the first time certain vital dyes like methylene blue for the treatment of certain bacteria. The scientists used the methylene dye to kill the bacteria. The next major contribution to chemotherapy came from Dominic et al., who used acid dyes like Frontozel, a dye with a sulfonamide side chain, for inhibiting the growth of streptococci infection. The Domo et al. Scientists, they used the azo dye for the decrease of the growth of streptococci infection. Later, in 1928, Sir Alexander Fleming, we all know that he discovered penicillin, which inhibited the growth of gram-positive organism. So, he is the father of penicillin. A chemotherapeutic agent may act by destroying the organisms, that is, it is bactericidal or by inhibiting the growth. The efficiency of the chemotherapeutic agent depends upon the natural body defense mechanism and the development of resistance by the microorganism to the particular agent. Host plays an important part in the curative action of most of the specific remedies. The third type in biological classification is pharmacodynamic agents. These drugs affect the normal processes of the body like blood circulation, hemodynamic process, that is blood pressure, cardiac outputs, etc. Pharmacodynamic agents include mainly the drug which affects the heart and blood circulation. It also includes a wide variety of drugs used in allergic and gastrointestinal disease. Fourth one is metabolic disease and endocrine function drugs. It includes variety of drugs which are used for metabolic disease such as anti-rheumatic and anti-immuno diseases, skin diseases, anti-inflammatory drugs and drugs used in endocrine disorders. So, based on the biological classification, we classify the drugs into four types. In the broad category of drugs, the second category is chemical classification. Based on the chemical present or chemicals used in the drugs, it is classified under the category chemical classification. The chemical classification is mainly based on the chemical structure. According to this classification, drugs may come under one or more of these categories such as quinones, semicarbacides, phenols, lactones, azo compounds, amides, alcohols, acetals, ketones, hydrocarbons, halogenated compounds, guanides, enols, esters, etc. So, the drugs may come under this type of categories. The implication of this classification is that similar chemical structure should yield similar biological activities. Thus, structurally close analogous compounds are grouped together with a small overall activity, but sometimes this classification is not very accurate as a few compounds with a similar structure lack the activity test. Chemical structural classification of drug is of advantage for study of methodology. That means the science dealing with the principle of procedure in research and study, and the structural activity relationship, that means SAR relationship. This classification was prevalent before 1950 itself, when the study of the therapeutic agents was according to their structure, disregarding their biochemical and biological relationship. But later on, it was found that not only the chemical structure, but the biochemical and the biological structure also plays an important role in determining the biological activity. For this statement, we give the example, all amino alcohols do not have the same biological activity. For this reason, classification of drug is considered more accurate on the basis of its therapeutic purpose, and it is widely accepted. Third classification, classification of drugs according to commercial consideration. The manufacturers and distributors of therapeutic agent, that means drug, classify the drugs according to their operational expenses, research investment and profit margins. Medicines for relatively rare disease are called orphan drugs, and such drugs lack patient protection as production costs are very much high and the demand is less. Another classification of chemical consideration depends on the way of administration of drug, that is, drugs are given orally, parenterally, by inhalation, sublingually, rectally, etc. On the whole, orally active drugs are preferred by the physicians and the patients. The fourth classification is classification of drugs by lay public, ourselves. The few broad public classification depends on the action of drug. For example, antiseptic, disinfectant, cough syrups, laxatives, purgatives, analgesics, tonics, ointments for skin disease, etc. But this classification is scientifically inadequate, and the public should be well informed about all aspects of the chemistry, biological action and the fate of medical agent by experimental biologists and the medicinal chemists. So, generally, the classification of drugs is mainly based on the 4 types. But for our syllabus, there are 16 types of drugs are discussed. So, we have to know what are the types of drugs, their definition and their action and their examples. Types are analgesics, antibacterial, anti-inflammatory, antipyretic, antibiotic, antitubercular, antiviral, antitussive, antiallergic, antidiabetics, antihypertensive, antiepileptics, tranquilizers, antiseptic and disinfectant, antimalarial and anesthetics. These 16 types are discussed for your syllabus. So, first we have to go to analgesics. These are drugs which by acting on the central nervous system cause insensibility to pain but without loss of consciousness. When taking the analgesics, we does not lose the consciousness, but there is only the insensibility to the pain part. So, this is called analgesics. Analgesics are classified into 2 different types. One is narcotic or strong analgesics, non-narcotic or weak analgesics. So, what is meant by narcotics? These drugs produce depression of the central nervous system. So, this is called the strong analgesics. Example, morphine, pethidine, etc. What is meant by non-narcotic? These drugs do not produce significant depression of the central nervous system. They also possess anti-inflammatory and antipyretic effect. So, this is called as weak analgesics. Example, aspirin, methyl salicylate, salicin, etc. So, second type, that is antibacterial. A drug used to control and destroy bacteria are called antibacterial. Example, penicillin, tetracycline, sulfonamide, etc. Third one is anti-inflammatory. The drug that reduces the conditions of inflammation such as redness of the skin, edema and formulation of granular tissues by controlling the causes of inflammation are called anti-inflammatory. Example, aspirin, salicylic acid, indole, pyrazole, paraminophenol. Fourth type is antipyretics. Antipyretics are drugs which reduce the elevated body temperature. The hypothalamus, situated at the base of the brain, regulate the body temperature. In fever, the body temperature increases and this antipyretic agent induces the hypothalamus to bring down the temperature to the normal level. Overdose of this drug will not bring down the temperature below a normal level. So, antipyretics is nothing but paracetamol, aspirin, sodium salicylate, etc. This is used to reduce the elevated body temperature, that means fever. Fifth type is antibiotics. These are chemical substances produced by microorganisms having the property of inhibiting the growth of or destroying other microorganisms in low concentration. This is called as antibiotics. Example, penicillin, streptomycin, chloromycetin, etc. Sixth type is antitubercular. The drugs used in the treatment of tuberculosis is called antitubercular drugs. The name itself, it denotes that it is used for the treatment of tuberculosis. Example, streptomycin, anticox, hydrosides, etc. Seventh type is antiviral. A drug used to control and destroy viruses are called antiviral. Example, ribavirin, acyclovir, etc. Eighth type is antitussive. The drug which oftenly takes, that means the drug which suppresses or inhibits our cough is called antitussives. Example for the antitussive is codeine. Anti-allergic. The drugs used to prevent allergic reaction in a body is called anti-allergic drugs. We know that example, cetirizine is the best example for anti-allergic. 10th one is anti-diabetics. The drugs that are used to control diabetes are called anti-diabetics. Example, insulin, chloropropamide, etc. 11th one is antihypertensive. A drug used to lower the blood pressure is called antihypertensive. Example for the antihypertensive is dioxide, nitroprusside, etc. Anti-epileptic. Anti-epileptic, the drugs which are used in the treatment of convulsive disorder like epilepsy are called epileptic drugs. The drugs which is used for the convulsive disorders. The example for anti-epileptic is barbituric acid. 13th one, tranquilizer. These are substances are also called psychotherapeutic drug. The drug which is used for therapeutic agent is called a psychotherapeutic agent is called a psychotherapeutic drug. These drugs affect the central nervous system and induce sleep to the patients. These substances are used to cure mental disease. They give strong sedation to the patient. The administration of these drugs, that means tranquilizer, make the patient passive and help to control his emotional distress. So, the tranquilizer acts to the patient and become passive and we can control his emotional distress. Example, Resprin, Thiotixin, etc. 14th one is antiseptic and disinfectant. Antiseptic are those chemicals which prevent the surfaces of wounds by inhibiting the action of microorganisms either by stopping their reproduction or by killing them. We all know that when we have the Lysol in our home, it can kill the growth of the microorganisms. Disinfectant. Disinfectant are chemically compounds which are applied to non-living or inanimate objects and they kill the organism immediately. So this is the disinfectant. Example for disinfectant is bleaching powder, DDT, BHC, etc. What are the difference between antiseptic and disinfectant? Antiseptic means it is used for the wounds. It prevents the growth of microorganisms. It is a milder but prolonged action. It is used to clean the surgical apparatus. So what is meant by disinfectant mean? It is used for non-living objects only. It kills the organisms. Immediate action but short duration only it works. It is used in public health and sanitation for cleaning water, etc. So cleaning water means we use bleaching powder for cleaning the water. 15th one is anti-malarial. A drug used which are effective in the suppression and treatment of malaria are called anti-malarial drugs. So best example for this anti-malarial drugs is chloroquine. 16th one, last one, the drugs which produce loss of sensation are called anesthetics. The analgesics and anesthetics are completely different. Anesthetics means it produces loss of sensation. Depending upon the action over the body, the anesthetics are classified into following two types. So what are the two types means general anesthetics and local anesthetics. General anesthetic means these substances produce unconsciousness all over the body by depressing the central nervous system to such an extent that the sensitivity to pain feeling is lost. The general anesthetic may be volatile or non-volatile. The volatile anesthetics may be applied by open mouth through simple mask that we can saw in the real life. Example, chloroform, ether, cyclopropane, etc. The non-volatile anesthetic may be administered parenterally or intravenous. They induce anesthesia very rapidly. This is used for the cesarean purpose. Example, thiopental, sodium, propanediol, etc. The last type is local anesthetics. These substances abolish the sensation of pain in localized area. They do not affect the whole body. The general anesthetics affect the whole body, but the local anesthetics only affected the applied part. That means they are applied topically or by injection and abolish the sensation in localized area only. The example for local anesthetics is cocaine, procaine, benzocaine, etc. So, dear students, today we recall about chemotherapy, that means the uses of drugs in our body. Thank you, girls.